Good day, all. Welcome back to this module. We are module 5. Today, we'll be looking at biological hazards, the global pandemic framework. Now, by way of objectives, you'll be learning in this module how to identify the key components of a global pandemic framework. We'll be able to understand the transmission mechanisms of biological hazards and strategies for control. In this module, we will also recognize the roles and responsibilities of individuals, governments, hospitals, and businesses in managing pandemics. We'll also be able to develop and evaluate strategies for pandemic preparedness, response, and recovery. Now, by way of introduction, pandemics and biological hazards are a growing concern worldwide as the global community faces ever-present threats of infectious disease outbreaks. The rapid speed of diseases such as COVID-19, Ebola, and SARS has alerted the need for robust pandemic management frameworks. This module explores the strategies for managing pandemics, controlling disease transmission, and minimizing the impact of biological hazards. Understanding how to prevent, detect, and manage pandemics is essential for safeguarding public health and ensuring a coordinated global response to health crisis. Now, let's look at pandemic management. We're looking at the control strategies and quarantine. Now, what is a pandemic? A pandemic is a global outbreak of a disease that spreads across countries and continents, affecting large portions of the population. Now, let's look at how it is transmitted, how pandemics is transmitted, the transmission mechanism. It can be transmitted through respiratory droplets, that means spread through coughing, sneezing, and close contact with person already affected. It can also be transmitted through bodily fluids such as blood or saliva. It can also be transmitted through contaminated surfaces and vectors, that is spread through surface or animals, e.g., mosquito for malaria. Now, what are some of the control strategies for a pandemic? We have quarantine and isolation. That means you isolate affected individuals and those who may have been exposed to this pandemic. Quarantine and isolation is a strategy. Then we have contact tracing. That means you track the individuals that have come in contact with the infected and you quarantine or isolate them. You can do contact tracking. You can also do hygiene and PPE. PPE is personal protective equipment. So hygiene such as hand hygiene, washing your face regularly, wearing a face mask, wearing gloves, and like I said, PPE, doing your personal protective equipment. Now let's look at some of the effective quarantine and isolation measures that you can carry out in the case of a pandemic outbreak. Now, for quarantine is preventing exposure to potentially affected individuals by isolating them for a specific period of time, like months or days or even years. Now, what's the purpose of quarantine? Is to prevent the spread of infection from individuals who may have been exposed. Now, quarantine zones are designated areas to house individuals who may have been exposed. That's a quarantine zone. Now, what are some of the challenges in quarantine? Some of the challenges is ensuring compliance, addressing the mental health of people involved, and managing the scarce resources to handle these persons. Now, let's look at number two. We have isolation. Isolation is the same thing as quarantine, but it's slightly different. This is separating confirmed infected individuals from healthy populations. But quarantine is preventing exposure to potentially affected individuals by isolating them for a specific period. So, isolation is the process of quarantining. So, this isolation, you are separating confirmed infected individuals, but quarantine, you are taking people that are potentially exposed and quarantining them, people that may have been exposed. But isolation is that you are taking confirmed infected individuals from the healthy population. Now we also have different kind of population. We have healthcare population. This is where dedicated hospital wings or temporary facility to treat affected individuals. We also have home isolation. This is where there are guidelines for isolating yourself at home to minimize the risk of spreading. Now, what are some of the response strategies for pandemics? We have global surveillance systems. This is where you monitor emerging infectious diseases through global health organizations such as WHO or CDC, right? Now, the global pandemic framework in this case is a coordinated international system designed to prevent, detect, and respond to, also to recover from large scale disease and infection caused by biological hazard. They are guided by the World Health Organization, WHO, the International Health Regulation, national public health agencies such as CDC, NCDC, and international partnerships and surveillance networks. Now, for the response strategies under preparedness, we have early detections. So you can put systems in place to identify outbreaks through monitoring of symptoms, diagnostic testing and reporting, stockpiling, ensuring there are sufficient supplies of medical resources, e.g., PPE, that is personal protective equipment, vaccines, and medications. You can also have public health education, that is educating the public on hygiene, vaccination, and protective behaviors. Now, for the response phase, you can do testing and diagnosis. This is rapid testing to confirm the disease and identify those that are affected. That's testing and diagnosis. We also have medical treatment, that is providing care for those affected, including antiviral treatment and supportive care. We also have public communication, where there is a clear and consistent communication from health authorities to the public to prevent panic. This is these are the response phases. When it has already happened, you do testing and diagnosis, you carry out medical treatment, and you carry out public communication. Now, what are some of the risk mitigation strategies for pandemics? Like I said before, early detection systems, global health monitoring using advanced surveillance systems to detect new outbreaks. You can also use AI. You can leverage AI to predict the spread of infections by analyzing travel patterns and genetic mutations. Now, for the prevention as a risk mitigation, we have vaccination. That means you are ensuring equitable distribution of vaccines. You are targeting at-risk populations. You can also have antiviral medications by stockpiling and distributing antiviral drugs to reduce disease progression. That is you can also do travel restrictions, which is limiting the movement of people from high risk regions. You can also do community preparedness as a risk mitigation strategy. You can have public health campaigns, that is, you are ensuring communities are well informed on hygiene practices, vaccination, and you can also do what they call social distancing. These are all part of community preparedness. Now, what are some of the roles, or what are the roles of stakeholders in pandemic management? Now, for individuals, there's personal hygiene. You can do frequent hand washing, wearing of face masks, maintaining social distance. You can also carry out vaccination participation. That is getting vaccinated to contribute to community immunity. This is a role of an individual. An individual can also have emergency kits. Having an emergency kit, preparedness with food, water, and medicines. Now, what's the role of government in pandemic management? They all have the role of creating policy and legislation, that is enforcing quarantine, isolation, and travel restriction. This is the role of government. They also have the role of resource allocation, ensuring the availability of medical supplies, vaccines, and healthcare personnel. They also have the duty of public information, issuing clear and accurate health guidelines and risk assessments. You also have the role of hospitals and healthcare providers. Now, they are broken down into two. We have medical care, we have such capacity. For the medical care, they should ensure, or they should treat infected individuals, manage resources, and provide vaccinations. Now, for such capacity, they should expand their healthcare capacity to accommodate more patients, especially in times of pandemic. Now, what are some of the pandemic preparedness response and recovery? For preparedness, we're looking at developing pandemic response plans, that is, plans for healthcare, business continuity, and public safety. For preparedness, we're looking at stockpiling medical resources, ensuring that there's a reserve of medicines, vaccines, and PPE. For training, ensure there's continuous training of healthcare workers, first time responders, and public health officials. For response, ensure there's a rapid action, quick implementation of testing, quarantine, and contact tracing. Now, there's also ensure healthcare system management by expanding hospitals, allocating resources, and prioritizing care. They also ensure, in terms of response, global collaboration, working with international bodies such as WHO for data sharing and resources. For recovery, they should ensure that there's economic support, financial aid for businesses and individuals affected by the pandemic, especially by government. There should also be public health evaluation, reviewing the effectiveness of pandemic response strategies. Now, by way of conclusion, this module covered biological hazard, particularly pandemics, and how they pose significant risk to global health. A coordinated multi-sector approach to pandemic management, encompassing prevention, response, and recovery, is essential for minimizing the impact of such crises. Through effective strategies, stakeholders can work together to mitigate the effects of pandemics and ensure global health security. Now, there's an assessment section where there's a quiz of 15 multiple choice questions and a short report you will write. That'll be all for Module 5. I'll see you in Module 6.